Body hair is something we've all had to come to terms with, but if you recently started noticing new hair growth or hair loss, you surely want to know what's going on. Here's a look at some of the things your body hair is trying to tell you.
But what if you had a disease that caused your hair to fall out?
If you find that you are losing your body hair, it could be an autoimmune disease at play. As explained by the Cleveland Clinic, when someone has alopecia areata, their immune system wages war on their hair follicles, resulting in a significant amount of hair loss. Hair may come out in clumps the size and shape of a quarter. While some people with alopecia may suddenly lose a lot of hair all over, others may lose it more slowly or in specific regions of the scalp or body. In less frequent instances, a person may lose their entire head of hair and/or all of their body hair, known as alopecia areata totalis and alopecia areata universalis, respectively. Furthermore, the health institution noted that alopecia occurs more often among people who have family members with autoimmune disorders such as diabetes, lupus, or thyroid disease. A sudden surge of male or female hormones could cause you to gain or lose body hair. According to Cedars-Sinai, hirsutism occurs when a woman has high quantities of male hormones, or androgens, coursing through her system. Her body responds by producing hair in all the places a man would typically grow it: the upper lip, chin, jawline, back, buttocks, and chest.
Maybe we just embrace our body hair.
According to the U.S. Department of Health and Human Services, this condition frequently accompanies polycystic ovary syndrome, or PCOS, a condition characterized as an imbalance in reproductive hormones. And no, it is not uncommon. In fact, 10% of women of childbearing age have PCOS, and 70% of them report an excess of body hair. PCOS is treatable, but it's important to note that hirsutism can also be a result of other serious conditions, so you should talk to your doctor and get an official diagnosis. If your thyroid produces too much of a specific hormone, it's considered overactive, resulting in what's known as hyperthyroidism. If your thyroid does not produce a sufficient supply of the necessary hormones, on the other hand, you could have an underactive thyroid, or hypothyroidism. These conditions can both result in a dry head of hair and thinning of hair on both your scalp and/or body. As suggested by WebMD, if you experience body hair loss, and regular hair loss for that matter, in tandem with other common symptoms such as fatigue, muscle weakness, weight loss or gain, or dry skin, you should consult with a medical professional about getting your thyroid tested. It is also important to note that certain medications that treat thyroid conditions can further fuel the hair loss fire. It can be challenging for you to determine if your thinning mane and body hair is a result of your thyroid condition or your treatment, so be sure to consult your doctor. Believe it or not, if you are losing body hair, it could be the result of a sexually transmitted infection or disease.
Herpes, I kicked you out ages ago.
I'm back, baby.
As noted by WebMD, certain STIs can lead to patchy hair loss. This is a common occurrence when someone has had syphilis for a while. So if your spotty scalp or body hair loss is accompanied by a sore throat and an itchless rash, you should consult your doctor. While no one really wants to talk about it out loud, getting prescription treatment for syphilis is critical to your long-term health. Your symptoms may initially clear up, but the infection will remain in your body, and you will eventually be dealing with more than just some occasional hair loss. Syphilis can seriously harm your vital organs. While hair loss is not a typical symptom of other sexually transmitted infections or disease, it can be a side effect of certain drugs used to treat these conditions. For example, Zovirax, a common treatment for herpes, can cause hair thinning, per Medical News Today. As noted by research published in Dermatology, Practical and Conceptual, when people experience hair loss, their diet should be examined, as a nutrient deficiency can play a significant factor.
What diet are you on?
Eggs and grapefruit.
When someone is lacking fatty acids, they may find that their scalp hair and eyebrow hair thins. A lack of biotin can lead to alopecia. Not having enough protein can also cause hair loss. Zinc and selenium are additional minerals that, when low, can result in thinning head and body hair. And by the way, if you do decide to take hair growth vitamins in an attempt to get a more luscious mane, don't be surprised if hair sprouts elsewhere. Clinical nutritionist Karina Chrysler explained to Well and Good that it's not a scalp-specific treatment. Just like a skin supplement wouldn't just target your face, hair growth supplements are going to affect all hair follicles, whether on your head, face, or legs.
I'm more than just a head of glorious, incredible, magical hair.
But don't worry, ladies, you're not going to suddenly grow a beard. She explained further, saying, facial hair that's not existing would only come about if the hormones in your body go out of whack and testosterone is increased. While many vitamins and minerals contribute to healthy hair growth, one of the most important nutrients needed for this process is iron. As explained by the Cleveland Clinic, when there's an insufficient supply of iron in the body, your blood becomes unable to make hemoglobin. This is the substance that is responsible for carrying oxygen for the regeneration and restoration of cells, including those that incite the growth of hair. If you are losing hair and suspect you have anemia or an iron deficiency, you should talk to your doctor. There are several ways you can boost your iron supply though, hopefully also stimulating the regrowth of hair. Because while you might not mind having to shave less often, you may not love the look of typical male or female pattern baldness.
What do you think I mean, bald? Bald! Bald, bald!
She's bald!
She's bald, Jared!
As suggested by Healthline, complete your diet with iron-rich foods like spinach, peas, lean proteins, and dried fruit. Cereal fortified with iron is another great option.
Then, just when you feel you are making peace with it all, what happens? The menopause comes. The menopause comes.
When perimenopause or menopause hits, you'll likely begin to notice some changes, including changes to your body, scalp, and facial hair. According to Prevention, estrogen levels are reduced during menopause, so testosterone rises, leading to all sorts of undesirable facial strays. Margaret E. Weirman, an endocrinologist, told the publication, "Initially horrifying, yes, but all perfectly normal." A study published in the British Journal of Dermatology sought to determine the likely patterns women can expect. The general findings indicated that 26% of postmenopausal women ages 45 or older experienced scalp hair loss, while just 9% reported frontal hair loss. Still, a whopping 39% of these women said that they acquired new facial hair during this period, with the chin being the most common area for the fuzz. Some women noted a loss of body hair, but this was more common with those who were older. As noted by the research, it's important for postmenopausal women to be able to distinguish, with the help of their doctors, normal changes in hair loss and growth versus abnormal ones, as the latter may be indicative of other health issues. You may find yourself losing your hair if you're under extreme stress.
I don't actually have any stress. I'm very relaxed.
That's all right.
I saw this in a TED Talk.
Kudos.
Nice choice.
Typically, when you think of this type of hair loss, you probably imagine losing the hair on your head. But as noted by Verywell Mind, quote, excessive physical or emotional stress, like that associated with injury, illness, or surgery, can lead to the occurrence of alopecia areata. When this happens, the white blood cells wage war on the hair follicles. You might notice patchy hair loss on your scalp, but it can affect the hair on your body too. Stress can also incite a case of telogen effluvium. When this happens, the hair stops growing, then falls out 2 to 3 months later. This can be shocking and devastating, but fortunately, it often grows back a few months later. Of course, no one wants to lose any type of hair due to a bout of intense stress. The good news is that with smart coping mechanisms like eating well, meditating, and exercising, you can help prevent the shed and keep yourself healthy, strong, and balanced. Congratulations, you're having a baby! Along with morning sickness, swollen calves, and varicose veins, you also get the pleasure of growing additional body hair. It's such a precious time though, isn't it?
Honey, I'm gonna part you like the Red Sea.
When you have a baby cooking, your hormones essentially go bananas, to be wholly unscientific. As explained by Healthline, you will get a surge in estrogen, which can cause an abundance of coarse hairs to crop up in new places. Most commonly, pregnant women note that their burgeoning bellies are subject to hair growth. If you have heard the old wives' tale that claims a hairy pregnancy belly means it's a boy, don't be fooled. This can happen regardless of your unborn baby's sex. Furthermore, you might develop hair on your arms, chest, face, shoulders, and other spots. The good news? Your mane will likely look fabulously thick and lustrous. Try not to worry though. You can choose to remove the hair, or you can wait for it to resolve on its own after your baby is born. It'll typically go away or fade within a few months postpartum. If body hair growth comes on fast and furious over the course of a few months, it can possibly be a red flag. Margaret E. Weirman told Prevention, "In these cases, we look for a tumor of the adrenal gland or ovary. Both are possibilities. It's not common, but it's something your doctor will check out."
I have cancer.
Per the Mayo Clinic, a pituitary tumor may alter hormone levels. While most pituitary tumors are non-cancerous, you and your doctor will want to form a plan of action to at least keep monitoring it. Type 2 diabetes is another possibility, as the condition can damage the cells in your hair follicles, according to WebMD. You may notice changes before you're ever diagnosed. Furthermore, type 2 diabetes can affect circulation in your feet and legs, causing you to lose body hair below the knee. These body hair changes could be serious or completely benign. Regardless, when you notice any significant changes in your body, including its hair, give your doctor the heads up. According to Medical News Today, lanugo hair is typically classified as thin, wispy hairs that appear on the body of a fetus. It usually disappears before or soon after birth. It turns out, though, that adolescents and even adults can develop a type of body hair growth that resembles lanugo. As noted by the health site, this frequently occurs when someone has the eating disorder known as anorexia nervosa. In fact, a 2009 study published in Dermatoendocrinology found that lanugo-type hair is one of the most common signs of anorexia. It often appears as, quote, fine, downy, pigmented hairs on the back, abdomen, and forearms. Furthermore, per the research, it is linked to a reduction in enzyme activity and could be caused by anorexia-driven hypothyroidism. An individual with anorexia will likely shed the lanugo hair once they are in recovery and a healthy, nutritious diet has been restored. If you are struggling with an eating disorder or know someone who is, help is available. Visit the National Eating Disorders Association (NEDA) website or contact NEDA's live helpline at 1-800-931-2237. You can also receive 24/7 crisis support via text. Text NEDA to 741-741.